Hi, and welcome to the G-tube medication administration video. This video is intended for a very narrow audience of College of DuPage practical nursing students who have to pass a return demonstration regarding medication administration through a G-tube. However, if you find this helpful for your own purposes, that's great, but keep in mind it was intended for that very narrow audience. Students, I just want you to be aware that we endeavor to use evidence-based practice in what we teach, and in order to do that we have done a small literature review. We have an article from October of 2009 from the American Journal of Nursing by Joseph Bulata about drug administration through enteric feeding tubes. A link to this is on your blackboard. There's a little post-test that you can kind of quiz yourself, and probably some of our midterm content will come from this, so you might want to check that out. In addition to that, we've taken a look at the policies and procedures of the local nursing homes where you do your clinical practice, just to make sure that we are at least consistent with what they are expecting of their employees, and that we're not violating any of their policies as we administer medications there. So you can be confident that that's the case. So check those things out on Blackboard. I'll set these aside. Another thing that you're going to need to have handy is your administration of medication via feeding tube, and this return demo sheet is available on Blackboard as well. There are certain aspects of it that were sort of written to go with nasogastric tube medication administration. What we want to show you when we get to the patient's room is actual G-tube, gastrostomy tube medication administration. So we'll point that out as we move along. So at this point, let's get started. So the first thing that we do, as with all return demos, is we take a look at the chart. Patient that we're working with today is Francois Baptiste. We're going to take a look at the orders, and students, COD students, be aware that we are dealing with the lavender orders now for the G-tube med demo. Okay, so Francois is to receive diazide 37.5 milligrams combined with 25 milligrams of hydrochlorothiazide. It's a combo medication, and you'll learn about that in lab, and you'll also look that up yourself. The parameters on this are that for systolic blood pressure less than 100, we would hold that. Warfarin, 5 milligrams per tube daily, hold for INR greater than 2.5. Robitussin, DM, 10 milliliters per tube, Q4 hours. We're checking here to see that this is a legal order. Okay, we're looking for signatures, we're looking for date and time, we're looking for proper use of labels on our medications, making sure that everything is correct. We don't need any clarification here. Then we also want to verify that the patient, the diet status, is he NPO or not, fluid restrictions, allergies, those types of things. So you'll check all of that with the chart. Then, with chart in hand, you'll refer to the patient's MAR. You know that we do this with all new orders. Now that you're in clinical, you know the practicality of checking the chart every time you pass medications is, you can't really do that. But when you have new orders, you have to always, you're responsible to make sure that the new orders have been properly transcribed from the chart to the MAR. And so consider that what you're doing now. These are new orders. So we're taking a look here to see that, that the diazide order has been properly transcribed, and it has been. Per tube daily. It's already been approved by pharmacy that this medication is okay to use through the tube. Warfarin, Warfarin, Robitussin, Robitussin, and the times are here. And the parameters are written. So we know that our order is good. We know everything is as it should be. It's been transferred over, so we can put the chart away. And that we shall do. Now we're working strictly with the MAR, and in the now that we're down to preparing the medications, after handling a chart that many people handle every day, we want to be sure that we do our hand hygiene. So we do that, and we for comfort's sake here at our cart, I'm going to deal with just this one patient's sheet, and I'm going to put the binder aside. All right. So we move on. First we want to make sure, let's take a look at what equipment we need for this process. We need the MAR, we need medication cups, we need a tray. We're going to need a pill crusher. What I could verbalize to my instructor as I'm doing this is that prior to coming into the med room to get ready, I've gone to take my patient's blood pressure, now that I realize that that's part of passing one of these meds, and I've delivered my piston syringe and irrigation set to the room, as well as my blue pad. So those things are in the room, so I don't have to try to juggle all of that while I'm out here. I've let Mr. Baptiste know that I'm coming with medications shortly. And you can do the same thing. So now, here I am at the med cart with my MAR, my cups, my tray, and I've got water for diluting the medications. So now I'm ready to pull the medications. Remember, I'm dealing with Mr. Francois Baptiste. I've pulled his tray. I'm going to take a look at what I need. I need a diazide. This is my first check, 37.525. I need a Coumadin, warfarin, 5 milligram. So I've got a capsule and a tablet and a liquid, my Robitussin DM. And I need to prepare these for administration through this tube. I'm putting his drawer away. Now I'm going to do my second check. I'm going to take a look at my diazide again, making sure I've got the right drug, the right dose, of course it's the right route, and the expiration date is what it should be there. We've got our warfarin, right dose, right expiration date, it's a tablet. And we have our liquid medication here. Robitussin DM liquid, 5 milliliters, has 100 milligrams of guaifenesin and 10 milligrams of dextromethorphan. So this is what's been ordered, and it's common to order this in terms of teaspoons or milliliters. It's been ordered 10 milliliters for this patient. I've looked in my drug book, that's fine for an adult, and that's what we'll administer. Now, when I crush medications, there are times when the coating on the outside of the tablet is made of some sort of plastic or some sort of thing that won't crush. So what I like to do is keep my hemostat handy so that I can pluck out the pieces that will probably not fit through the G-tube without clogging it. So I clean these first off, making sure they're clean, so that I'm ready to use them, something like tweezers, to pluck that residue out. So I recommend that you bring your own for that, because the school doesn't provide those. I'm going to keep my own garbage off to the side here. Okay. And I'm ready to begin.